This afternoon, after medical consultation, Mr. Ruby was taken to the operating room and under local anesthesia had a tube inserted into his right chest to allow more complete removal of the fluid. Then a lymph node biopsy was performed under local anesthesia. The lymph node revealed tumor on microscopic examination. Mr. Ruby tolerated the procedure well, and by 3:30 had returned to his room and was able to take nourishments. At this time, the source of the tumor is unknown. Early in the week, studies to determine the site will be initiated. The findings of these studies will determine his further treatment. His general condition this afternoon is considerably improved over yesterday. The question is, does Mr. Ruby have a cancerous tumor? The answer being, yes, Mr. Ruby does have a tumor which appears cancerous.
His chances of being cured are what, sir?
His chances of being cured at this time cannot be predicted because we do not know the source in his body from whence this tumor came. But remember that Arthur Godfrey, for example, had a extensive tumor removed a number of years ago and is doing quite satisfactorily at the present time. Certainly in 1966 we have a number of means of controlling tumors, and it will depend specifically on what type of tumor this is. The question is, at this point, does Jack Ruby have a tumor in his right lung? I cannot answer this yet because actually the fluid has just been removed and the fluid was compressing the right lung so that we could not see it fully aerated. And the fluid, we have not seen an X-ray since Dr. Webb inserted a tube to remove all of the fluid.
Would the fluid itself be indicative of a tumor?
The fluid could be either infection or a tumor. The question is, did we have an opportunity to see Mr. Ruby as soon as is possible? And I think this is a very difficult thing to answer. Certainly at the time we saw him, he was in need of medical attention. The question was asked, would he be able to stand trial in the next month or so, and from our present information, I would suspect not.